Good morning, good afternoon, good night to everyone. Thank you again, Professor Ayman Kanan, for the invitation. It's a huge pleasure to me and for each neuroanatomist around the world to be present in this important webinar honoring the lifetime achievement of Professor Albert Roton, who give us to every neurosurgeon and the importance to have in mind the microsurgical neuroanatomy with so special detailed descriptions and the impact in our surgeries has been and is very, very important. Thanks again. I want to share with you a topic about a venous structure that it's not so frequent to talk about it. And this topic is related with to the veins that drains to the superior petrosal sinus. When we have to reach in our surgeries to the trigeminal nerve in order to decompress the trigeminal nerve, or in order to resect small trigeminal schwannomas or meningiomas to this portion, very frequently, we find in our surgical corridor with bridging veins that connect the cerebellum surface or the brainstem surface, anterolateral surface, to the superior petrosal sinus. And sometimes when we find this vein, frequently we think that it is proper to coagulate and cut it or not. And we want to share our experience and our own classification of these bridged veins in order to our experience. First of all, we need to remember that the anterolateral surface of the brainstem and the petrosal surface of the cerebellum have many venous structures. Some of these are small veins that connect the pial surface of the midbrain, the pons, and the upper surface of the medulla, and the petrosal surface of the cerebellum. Professor Roton in his book described each vein in a detailed way. We have the proper name of each veins, but it is very important to remember that these veins from the anterolateral aspect of the brainstem and from the petrosal surface of the cerebellum usually drains as bridging veins to the superior petrosal sinus. But it's important to remind that the most medial bridging vein that drains to the superior petrosal sinus frequently are the veins that drain the venous blood of the brainstem, and the most lateral one are related to the drainage of the cerebellum surface. There is an important article that the name is Anatomy of the Superior Petrosal Veins Under Exposure and Management During Petrosal Apex Meningioma Surgery, but it is important because these authors divide in 4 groups the veins that drains in the anterolateral aspect of the brainstem and cerebellum. In 4 groups: the anterior pontomesencephalic group, the petros group, the tentorial group of the veins, and the posterior mesencephalic venous group. I strongly recommend the reading of this article because it's interesting in order to comprehend the venous drainage of this aspect. Here we have an anterolateral view of the brainstem and cerebellum, and again, we can classify in anterior pontomesencephalic group, the petros group, tentorial group, a pontomesencephalic group. And frequently, these 4 groups, from medial to lateral, drains as a common bridging vein to the superior petrosal sinus. Here we have an interesting 3D modeling of the venous sinus of the skull in general, but we need to put attention in this sinus, the superior petrosal sinus, especially focused when we need to access to the ponto pontocerebellum angle in retrosigmoid approach for different kinds of pathologies, because this bridging vein we can find during our microsurgical trajectory. Of course, when we think to approach lesions or neurosurgical real scenarios through the retrosigmoid approach, we need to think in neurovascular decompression, not only to the trigeminal nerve, because sometimes we need to decompress the fascial nerve or the lower cranial nerves, schwannomas of the trigeminal or of the vestibular schwannomas, meningiomas, and epidermoid tumors located in the cerebellopontine angle. In a higher view of this beautiful specimen, we can observe the 7 and 8 cranial nerve, the 5 cranial nerve, and here we have an important structure that is an interesting landmark, like GPS in our retrosigmoid approach, that is the suprameatal tubercle, because it is located above to the internal acoustic meatus. This landmark is really, really important for us because we use it to classify the bridging veins that drain to the superior petrosal sinus in 3 subtypes: medial to the suprameatal tubercle, located over the suprameatal tubercle, and lateral to the suprameatal tubercle. Here we can observe an anterolateral, and posterolateral view of the tentorial surface of the cerebellum, and here we are observing a bridging vein that drains the lateral surface of the brainstem, the lateral surface of the pons, and here is receiving vein to the tentorial surface. And it is located medially to the suprameatal tubercle. Here, another beautiful specimen where we can observe a vein, a bridging vein that drains over the suprameatal tubercle that was drilled here. And it is located at the level of the suprameatal tubercle. Here we have another vein that it is medially to the suprameatal tubercle. It's very important because we need to take care, especially with the veins that are located medially to the suprameatal tubercle. If we perform in this cadaver a retrosigmoid approach, a classic retrosigmoid approach, where we can observe the tubing line that is an important landmark for the posterior fossa, but we think that, agreeing with several authors, that the suprameatal tubercle is another important landmark, like anatomical GPEs, in order to localize the different structures located in the cerebellopontine angle. Here we have a vein that drains over the suprameatal tubercle, and we can find vein located more medially or more lateral. And these are original drawings that will be part of, hopefully, of a paper that we are preparing to send for the analysis for publication, where we divided the veins in retromeatal bridging veins, meatal bridging veins located at the level of the suprameatal bridging vein, located medially, and most of time located at the level of the trigeminal nerve. And some of these veins could be related with the venous compression of the trigeminal nerve. Here we have a beautiful dissection in a superior view, where we have two kinds of vein. We have here a retromeatal vein here, and a premeatal vein, two premeatal veins in medially located, retromeatal vein And here we have two veins located in close relation with the trigeminal nerve, sometimes related with trigeminal neuralgia, when the trigeminal nerve have not arterial conflicts. The vein could be related with pain. And it is important not only for operate neurovascular trigeminal neuralgia due to vascular compression, and here we have another, this is a fascial compression with the ICA, and here we can observe in the same patient a tumor located in the trigeminal porus. This is a trigeminal schwannoma with a vascular compression. The patient suffered fascial pain, and the patient suffered tinnitus and vertigo too. Here we have several cases of different tumors located related with the cerebropontine angle. These are all different kind of schwannomas. And here we want to present different surgical scenarios, especially applied to trigeminal neurovascular neurovascular decompression of the trigeminal nerve. Here we have the suprameatal tubercle, and this is a perfect case of a retromeatal vein, bridging vein. And it is impossible to reach the trigeminal nerve without coagulating this vein and cutting the vein, as we can observe here. And here we reached the trigeminal nerve, where we can observe that the ICA crossing under the trigeminal nerve, and here it's the artery and the vein decompressed using a small piece of Helfoalm or Teflon. Another case of a retromeatal vein, here is the suprameatal tubercle, and this vein was coagulated and cut, as we can observe here. Here is the suprameatal tubercle. That is an important landmark to choose if I am able to coagulate the vein or not. And here the trigeminal nerve decompressed. Here is a case of a meatal bridging petrosal vein. Here is a simple, unique vein draining to the superior petrosal sinus. Especially for young neurosurgeons or for residents, there are a way to know where the superior petrosal sinus is located. If we follow the dura mater that covers the suprameatal tubercle, there is a point or an angle where the dura mater turns, and the direction is from anterior to posteriorly, that is the tentorium, and in this point, in contact with this two layer of dura mater, is located the superior petrosal sinus. This vein should be coagulated in order to reach the trigeminal nerve again for another trigeminal neuralgia due to an arterial compression of the nerve. Another case, here we can observe a small suprameatal tubercle. In each case, we observe the suprameatal tubercle. Sometimes the suprameatal tubercle is small, like in this case. Yes, we can observe a small suprameatal tubercle, and sometimes it's really huge. And especially if we need to reach medial surgical goals like a compression or a tumor, sometimes the suprameatal tubercle is in the middle of our surgical corridor and needs to be drilled out. Here we can observe two meatal veins that were coagulated in order to decompress the nerve to this dolichothoracic vertebral artery compressing the nerve. In this case, we can observe a postmeatal bridging vein. Here is the suprameatal tubercle, and medially to it, we are observing this suprameatal, these two postmeatal veins. Here, the veins were divided, and we work between the angle of these two veins until the end of the surgery. Another case of a postmeatal vein, here two postmeatal vein. In this case, we need to cut the superior one in order to reach the trigeminal nerve and decompress the nerve to the arterial compression. Here is a beautiful dissection where we are observing a postmeatal vein here, and with the endoscope we can observe that the postmeatal vein drains some of the veins of the pons and the middle cerebellar peduncle. Not only for neurovascular decompression, it's important to keep in mind the importance to preserve the veins or coagulated. If we are operating tumors located on the posterior fossa, like in this left retrosigmoid approach for a schwannoma. This is a case of a small schwannoma, and here we have the suprameatal tubercle, and this is a postmeatal vein, and we know that this vein is important to preserve to the end of the surgery, because some of the veins that drain through this postmeatal vein, bridging vein, are the veins that drain the lateral surface of the midbrain, the lateral surface of the pons, and the venous infarction of this more medial bridging vein could have to the patient some kind of morbidities after the surgery. We are removing the tumor, and this is the final view of the surgery with this postmeatal, premeatal, bridging vein medially located to the suprameatal tubercle. This is another case of a huge schwannoma, Hanover 4B, a solid tumor. This is the intracanalicular part that is removed following the tubing lines. And here we can observe a medial bridging vein draining to the superior petrosal sinus that need to be preserved. In order to summarize, all veins located medial to the suprameatal tubercle in our case of several surgeries were preserved in order to avoid venous infarction. The veins located at the level of the suprameatal tubercles and lateral to the suprameatal tubercle could be coagulated because the patient have not any problem in the postoperative period due to this vein drains the petrosal surface of the cerebellum. And finally, in order to finalize this lecture, I will have here an interesting words from Professor Albert Roton. If we keep doing more, we will find more. Each advance redefines what we do for our patients. Thank you very much again for the invitation, Professor Einat.